ABC 7 News at 6:30.
Well, coming up next, local doctors use breakthrough techniques to repair broken bones that otherwise might not heal. Well, some medical news now. There is new hope for people who've suffered damage to their bones, either from severe breaks or infection. Surgeons at San Francisco General's Orthopedic Trauma Institute have figured out a way to regrow entire new sections.
Now, the other thing you see here is you see all the scars that he has.
The scars aren't pretty, but attorney Rick Tricardon is grateful to have a healthy leg at all. During an earlier surgery to correct an arthritic knee, his bone became infected with the dangerous bacteria MRSA.
And so I was very concerned that I might lose my leg, might lose my life.
After several follow-up treatments, the bone was still refusing to heal. Rick was eventually referred to Dr. Amir Medidyahu with the Orthopedic Trauma Institute at San Francisco General Hospital.
So what we need to do is basically take this piece, hold it somehow, and then clean this up.
In other words, remove a significant section of bone. Dr. Medidyahu's team then replaced it temporarily with a bacteria-killing bone cement, a technique refined in just the last few years.
And inside that bone cement, we put a very high dose of antibiotics. And that antibiotics then elutes in the area of the bone cement where we put it. And so there's a very, very high concentration of antibiotics in that area.
After killing the bacteria and removing the cement, the leg was left with a gap. But by placing specialized hardware, often guided by computer, Dr. Medidyahu says surgeons at the Institute are now able to close gaps as wide as 12 inches.
The body's an amazing thing. The body can create a membrane, and that membrane will have all the proteins and the stem cells that you need in order to create new bone.
In extreme cases, like the patient in this x-ray, doctors will partially sever sections of bone on either side of the gap, slowly pulling them together with hardware. Replacement bone grows in behind, eventually creating a bone bridge that joins in the middle.
The idea is to give the person a functional leg, a leg they can walk on, the leg that is the same length as the other leg.
In Rick's case, the procedure was simpler. A small section of bone from another part of his body was transferred into the gap, allowing his tibia to grow new bone around it.
So here the bone is completely filled in. You can't even tell that he had any issues there.
It's been a long, slow process, but Rick believes a full recovery is still within reach.
My goal is to get back and play handball and to be able to carry my clubs on a golf course.
And because of the bone's ability to regenerate, doctors say even long sections of replacement bone will eventually heal, functioning as normally as the bone they replaced.
Wow.